In this video, we are going to have an anatomical terminology for the planes, directions, and cavities. This is going to be fundamental terminology, so the following terms are crucial to the study of healthcare. So anatomy is a branch of science that deals with the structural organization of the body, while physiology is the study of the function of the body. The processes which occur within the systems of the human body include growth, reproduction, and metabolism. So in the anatomical position, the body is in an upright position with the head and feet facing forward, while the arms are at the sides of the body and the palms are facing forward. So let's have a look at body planes, directions, and cavities. But why do we need a standard terminology? Well, to keep presence, you must be able to identify areas of the body for treatments, injections, or diagnosis. Directional terms locate a portion of the body or describe a position of the body, for example, supine or prone. For examination purposes, patients are either lying face up, supine, or face down, prone. Anatomical position can be further defined by dividing the body into three different anatomical planes or sections. Directional terms are created by these planes. So we have three main planes: frontal or coronal, transverse or horizontal, and finally sagittal or medium. The frontal or coronal plane divides the body into equal front and back sections. So those body parts in front of plane or on the front of the body are called anterior or ventral, while body parts in back of plane or on the back of the body are called posterior or dorsal. The horizontal plane divides the body into top and bottom parts. Those body parts above other parts are called superior, while body parts below other parts are called inferior. For example, knee is superior to ankle, but inferior to hip. The sagittal median plane divides the body into equal right and left sides. The sagittal plane divides the body into equal halves. Those body parts close to the midline or plane are called medial, while those body parts away from the midline are called lateral. And finally, we have other directional terms. For example, proximal, body parts close to the main trunk of the body, generally called the point of reference. Then we have distal, body part distant from the point of reference. Superficial, towards the body surface, and deep, away from the body surface. And finally, we have body cavities, spaces within body that contain vital organs. There are two main body cavities. The first one, dorsal, one long, continuous cavity located on back of the body. It is divided into two sections: cranial, which contains the brain, and the spinal cavity, which contains the spinal cord. And the second one is ventral, on the front side of the body, and it is separated into two distinct parts by diaphragm. The thoracic cavity is located in chest and contains heart, lungs, and media blood vessels. Then the abdominal cavity is divided into upper and lower parts. The upper abdominal cavity contains organs of digestive and urinary system. And finally, The pelvic cavity contains reproductive organs. You can have a look at them in this picture. And also, the abdominal cavity is so large that it is divided into smaller parts. One method is into quadrants. We have the right upper, the left upper, the right lower, and the left lower quadrants. And another method is into regions. And here we can see the difference between acute and chronic. Acute refers to immediate. For example, acute care would be the care a patient receives immediately after an injury. The injury itself can be referred to as acute. For example, acute low back pain resulting from a muscle strain. And chronic refers to ongoing or long-term. For example, chronic care refers to ongoing care over a period of time. The injury or pain can also be referred to as chronic. For example, chronic low back pain may develop in patients with arthritis. And finally, we are going to check your knowledge of or understanding of this topic. Here you have several questions. The first one: how do the fields of anatomy and psychology differ in their approach? The second one: when a bachelor is in a baseball game swings the bat, what plane is he operating within? And the next question is: why would it be necessary for a healthcare professional to have a solid understanding of anatomical terminology? Now we have some situations. For example, Loretta complains of abdominal pain. The emergency room physician suspects that she may have appendicitis. In which of the following quadrants is the appendix located? Is it A, B, C, or D? And in this one, this patient is being examined. Which of the following positions is he in? Prone or supine? Now complete the following statements by adding the correct directional terms. And to conclude, what are the opposites for the following directional terms? And that's all. We have a look at the basic anatomical terminology. Bye.